For children with autism, communication, social and learning skills can be developed and refined with applied behavior analysis therapy, or ABA. Compassionate and meticulous ABA clinicians continuously look for ways to tailor the experience based on every child's need in order to achieve the best results.
ABA is a science. It's an evidence-based practice that we use to promote positive behavior change. For ABA therapy, what makes it so different is the individualization that we provide. From the moment I speak with a patient and their family, everything is individualized. We really work to pay attention to, obviously, medical needs, as well as additional diagnoses. And then, do we need a trauma-informed approach with this kiddo? Is there something else that we really need to attend to?
A criticism of ABA has been that we are overly compliance-driven. Inside of the clinic, we're contriving situations and overly controlling environments and then focusing on the patient's compliance with that programming. And that is actually a problem for most of our patients because they do have some of those social deficits and those language deficits. So they're already struggling to make it in that environment, and now we've set them with tools that do not prepare them for those settings. So what we're focusing on is learning and skill versus a short demonstration of compliance to a program. You have to listen to the people that are receiving your services. So we need to look at some of those individuals who may have gone through ABA therapy. What are they telling us now? And we need to take their feedback and say, okay, moving forward, what are we going to do differently? How are we going to be better? Another piece that's happening is we are looking at value-based care models and value-based payment. And what that really means is looking at what are the outcomes for this individual and what are the costs associated with that? And then how can we measure providers and actually start rewarding providers? So through value-based care, we're rewarding providers that have excellent patient outcomes.
The process of diagnosing a child with autism and the follow-up treatment may be intimidating, but the board-certified behavior analysts at Reach High Consulting in Bloomington and Evansville, Indiana, are here to guide families on this journey.
Reach High began for me finding a need. That need came from my own personal experiences as a mother. And I began asking the question, what resources are available? There weren't very many professionals that were able to point me in a direction. We became an answer of what happens after the diagnosis and being able to give families a resource, give families an answer, give families direction. The core purpose for Reach High Consulting and Therapy is to elevate the quality of life for our people, for our clients, and our field by being better today than we were yesterday. So to the family that is looking for resources in applied behavior analysis, it is a great option because it is individualized. And so when you're looking for those supports that can help you to get from here to there, you need someone that can take that into account. And that is individualized support, and then adding that layer of medical professional expertise. We are a place that is focused on partnering with you, an organization that is here to create that individualized support. And what makes Reach High amazing is the fact that we do that not only with our clients, but also with our staff. We want to see the people that we get the opportunity to serve to grow. And that growth is what keeps our services transformational.
So we are looking primarily for experience that is very beneficial in this field. However, we are very willing to teach all of that to those who are willing to learn all of the information. Typically with ABA certification, you would go through 40 hours of online coursework. We found it to be where there's kind of a disconnect between what you learned online and what you actually are doing when you're on the floor working with our clients. So I was able to kind of revamp the training that we have here. Instead of doing 40 hours of videos, we have more of a classroom style training and then starting to integrate the technician in with our clients as well. So just a little bit more of a hands-on approach we found has been really beneficial in creating really high quality technicians.
So I would say in the next year or so, the focus is going to be on how do we provide excellent mentorship opportunities for new BCBAs? How do we provide ongoing training and effective training for RBTs? And so we will keep looking at society at cultural aspects, and we will want to continue to change and evolve so that we're meeting those needs for our patients and for our employees, because our employees are a big piece of that too. So I would say one thing you should know about ABA therapy or any therapy in general, if it does not feel right for you, you should seek something that's a better fit. And one thing I think that individuals should know about us at Reach High Therapy is that patient-centered, person-first focus that we have for our clients. We are not afraid to change direction. If we are wrong or if it's just not going as planned, we are always looking to do better, and we are always receptive to input from families.
Elevating the quality of life for our people, our clients, and our field by being better today than we were yesterday. To learn more or schedule a call with our team, visit reachhighconsulting.org.